With us is Dr. Richard Stanley. Dr. Stanley, it's good to see you today.
Good to see you again, Myron.
Today we're going to talk about cosmetic dentistry.
I think most people know the name of veneers now. Certainly the Extreme Makeovers has brought that to light. This is a case that we did, I believe, about 10 years ago, and it still shows up to show how nice this kind of dentistry is and how good it looked even 10 years ago, and the materials have continued to improve. In her case, she had, again, discoloration of the teeth, some stains on this tooth in particular because it had trauma at an early age, and spaces between the teeth. And when we did the veneers with her, we did the front 6 teeth in this case because the rest of her teeth are really pretty nice. We bleached her teeth, brought the color up across the board, and then we did the 6 veneers. So really a pretty case, and it's held up really well. We see her occasionally still, even though she's moved up north. When she comes down here, we get to take a look at her teeth again. And again, with porcelain restorations here, one of the things that we like to see is that it looks so pretty along the gum line. I think most people that have seen dentistry from the past, particularly our front teeth, have become aware of these black lines along the gum line, and that's caused by the metal core that was in the old style of crowns, and it would cast a shadow up along the gum line. So this is the same patient. Once the porcelain fused to metal crowns have been removed and replaced with all porcelain crowns, you can see how pretty that looks. Mm-hmm. And in fact, we don't even have to go underneath the gum with these to make them look pretty. These stop right at the edge of the gum, so they won't ever change, even if the gums do change.
So those who have had these in the past and went through tremendous trauma in having them placed, it's not like that any longer.
It's pretty easy now. Yeah. The materials have gotten better, which allows us to do things more efficiently with the patients. They're in and out much more easily. They feel better afterwards, and they can generally go, when we do these big cases, they can go out to dinner that night in most cases and function just fine. Yeah. We talk a lot about gummy smiles and the effect that the gums have on the aesthetics of teeth. In this case, we've raised the gums up to get rid of the gumminess of the smile, and then placed the porcelain veneers on there to give it really a much more aesthetic look. And those are the kinds of things that really change a person's overall look. They just look, they look healthier, they look happier. It raises their visual IQ, I think. You look at, they just look smarter. Again, this is fairly graphic, but again, just showing the procedure. And in this case, we've used a laser to go up there and recontour the gums on this side. And then we do the next side. And then this is immediately after we've done this. You can see how the tissue all looks. It looks fine. This particular patient, I know, went to a Christmas party that night. So there was no discomfort afterwards. You just have to brush it gently so that you don't stir it up there. But there's no stitches or anything. In these kinds of cases, we can do it with a laser, and they're right back in action again. So really a nice procedure for people that have a gummy smile there. It's not a procedure that you can do on every gummy smile case, but the majority of the cases we see, we're able to do it right in-house like that, and they can go right out and go right back to activities.
Makes some pretty happy patients.
And pretty good looking, too.
Absolutely.
Yeah. And again, just a little bit about implants. Certainly implants are really coming of their own now. The success rate on implants is about the same as anything else that we do in dentistry. And for people that like to put a number on that, the success rate is about 98% at 15 years, which, to put in a different term, means that at 15 years, 98% of the implants we put in are doing just exactly, they're functioning exactly the same as they did the day we put them in. And there's a variety of kinds of implants. For people who have no teeth at all, you can go in there and place a half a dozen or 10 implants in their mouth and then restore that with teeth that stay in there just like their own teeth. Or if they're more budget conscious, sometimes we'll place just 2 or 4 implants and place a prosthesis that can just snap on top of that, like a partial or a denture. They can snap onto it, something that they can take out and clean and snap back onto the implants, so it gives them a lot more stability and retention than they had when they didn't have any teeth at all there.
Yeah, it makes a big difference. You could eat the corn and the apples and all of those things, then you don't have to have whatever the little glue that went between the denture and the gums.
Exactly. The glue never seems to work very well. People come in and they're always asking me, is there a better glue out there? I haven't found one yet. I think the best glue now is the implants.
Right, that's the best glue. Snap them on and leave them on.
Exactly. And I think that brings us to the vision. And of course, everything that we're doing nowadays, whether it's implants or cosmetic dentistry or neuromuscular dentistry, we're trying to redevelop what nature would have wanted to have there originally, which is beautiful teeth that function well, allow us to chew and talk, the things that we do with our mouth, and provide support for our face and something that's going to last us for a lifetime. Even if we have to go in there and do some repair work on it at some point or replace a crown, the goal is to get through life and still have a full complement of teeth that function the way they're designed to.